This is your face. Don't cheap out on your face. This is the most commonly asked question about dermal fillers in clinic.
So I actually feel sorry for patients.
In the UK, you can purchase fillers on the black market for as little as nothing. Undoubtedly, you're going to end up with a botched job. I mean, we see so many people that come from other clinics and there's no antibiotics, no aftercare, no anything.
It's not just about you getting a treatment today with a good before and after today, but how does it look in 6 months' time, 12 months' time, 18 months' time?
Will my dermal filler treatment go wrong? These are the top 5 reasons why people are scared to get dermal filler treatment.
My name's Dr. Sanjay Trikha and this is Dr. Zoya Diwan. We run the clinic Trikwan Aesthetics in Mayfair and we've seen thousands of patients over many, many years, and we want to share some of the biggest concerns that our patients have when it comes to receiving dermal filler treatments and how we've managed to overcome them.
And we'll try and get rid of some of the myths out there as well, things that might be hindering you that aren't necessarily things that are true. So in at number 5 is that you're worried it will not look natural.
So in terms of natural look aesthetics, I think the most important thing probably is going to be the consultation, because when you're having that conversation with your doctor, it's so important for the doctor to really understand exactly what it is that you're looking for. Most patients, in our clinic at least, are going to be generally aged 25 to 45. They've never had a treatment done ever before in their lives, and most crucially, they don't actually want to look different, they just want to look refreshed or a bit restored, or a little bit like how they feel that they used to look not too long ago, but just a bit more restored.
Other things that really ensure that your treatment is very natural looking is obviously using the right quality of product. There's many different brands out there. There's over 200 different brands, and there's only a few that we find really give that natural looking and, more importantly, long lasting results, because a lot of them can look good for like a few months, but there's not many that can look good for a long time. Natural look also means that you've got to go to someone who really understands the anatomy of aging, the anatomy of your proportions, what is natural looking to you, and also just really understanding what you're after and not trying to push and get you to be overfilled in any way. It's always better to start off subtle and then add more gradually. We have a very gradual and sort of gentle approach to fillers in the clinic, and I think that really helps and ensures that people don't really go overboard and that you look natural.
So I think before COVID, our clinic, like most clinics, probably had 30-minute appointments. So I'd almost say it was the industry norm for people to come in, you have a discussion for 10 minutes, progress onto a treatment for 15 minutes, and then 5 minutes of aftercare. It was basically how we operated for many years. Having said that, since COVID, we've kind of changed how we work, because at the time we changed it to 1-hour slots. We wanted to make sure there was never a wait in our waiting room, and we wanted to make sure we had ample time between patients to make sure all our protocols were being followed. But actually having that extra hour completely changed our own practice, because now we've got a very long amount of time to really go into depth with patients about exactly what they're hoping to see. And from my experience, the more a patient understands the procedure, the happier they're going to be, because the more something makes sense to them, the more that they understand exactly what it is you're doing, the more likely when they look in the mirror straight after, it's going to be exactly what they expect, because there's good understanding between practitioner and patient. In at number 4, the procedure is too painful.
Well, to be honest, I don't think we've ever had any patient that has not been able to go through treatment and found that it was too painful, right?
Yes, correct.
And that's down to a number of different reasons. So first and foremost, we pop lots of numbing cream on for you beforehand, and that stays on for a good 5 to 10 minutes. The products that we use, most of the fillers that we use in the clinic also have something called lidocaine inside them, which is local anesthetic. So that will also help the area go a bit more numb. We use very small needles, and to be honest, a lot of the feedback that we get from patients is, especially if they've been somewhere else before, is the soft-handedness of the treatment. They kind of feel that you're being a lot more gentle, because some people or some practitioners can be a bit more heavy-handed and find that the treatment is a bit more painful from that aspect. So I think your practitioner and the way they practice and the way they inject also has a big part to play.
Also, different treatments are different. For example, if you're going to be working in certain layers of tissue, let's say the lips, for example, are quite famously a little bit more of a stingy procedure compared to other treatments, for example, the cheek or the chin or the jawline, and that's to do with the layer of anatomy that you're actually in. Skin treatments, for example, can be quite stingy. If you think about it, imagine if you got a paper cut, that's probably one of the most painful things you can experience just in terms of it actually really, really stinging, and that's because it's right in the skin where all of your pain fibers actually are. So again, this comes down to the consultation and communication, because ideally, when we're talking to a patient, I want to give every patient an accurate idea of how every injection is going to feel, just so nothing surprises them. Because if you know something's going to be a bit stingy, but you're ready for it, that's okay. But if you don't know it's going to be stingy and you're not ready for it, oh my God, you'll jump off the couch. So it's really important to make sure that you've got an idea of how it's going to feel right before you receive any injection.
And saying that, most dermal filler treatments are in a deeper layer than the surface of your skin, like you said, which is probably more painful, whereas most of the dermal filler treatments are deeper, so they're not as painful. Plus, the treatments themselves aren't very long at all. The consultation, like we mentioned before, is the long part of the process, understanding exactly what it is that you want and we're on the same page. That takes the longest, but the treatment's very short. So even if you are finding it a bit painful, it's not very long. But most people don't.
I mean, the way that I often describe it with most treatments, I'd say it's more like uncomfortably comfortable, because of course you're not used to having an injectable treatment within your face. It doesn't sound like something natural or sound like something that's going to be pleasant. But by the same token, it's not actually that bad. So as it's going on, you're probably thinking, or at least I am when I receive a treatment, oh my God, this is going to be really bad, this is going to really hurt, and then it's happening. And I'm kind of waiting for the pain that doesn't quite come. It doesn't mean that it's painless, or it doesn't mean that I feel nothing. It's more a case of it doesn't actually get that bad. It's more just a little bit uncomfortable, a little bit strange, and it passes very quickly. And then you think, oh, is that it? That was okay.
Yeah, exactly. So in at number 3 is that you just don't know enough about the process. So that could mean don't know enough about dermal fillers, or you don't know enough about the clinic that you're going to be going to.
So at Trikwan, our ethos is research, educate, empower. And by this, really, it's a message for patients, because the first step of this process really is the patient researching the practitioner or the clinic where they're going to go to. Unfortunately, we live in a day and age where there's so much information that you can see online, whether it's before and afters on social medias, whether it's testimonials or reviews from third-party providers such as Google, whether it's just images online of the clinic or the practitioners themselves, or even YouTube videos.
So at the point that you're in the clinic, you should feel really comfortable by obviously the reception staff. Even beforehand, when you're talking via email to or on the phone to the staff, it should feel really warm and welcoming. When you're in with your doctor, you should feel free to ask as many questions as you like, feel really comfortable and confident before you go through with your treatment, and not feel any pressure to do anything that you don't wish to do.
Yeah, so the consultation really is a point in time where the doctor should really be educating you on everything that you need to know. For example, if a patient comes in because they feel like they look tired, that doesn't mean that they understand what anatomical changes are happening over time that are going to contribute towards them looking tired. So, for example, a patient might focus on something like just their under eye because that's what they see and notice, but actually it might be a different area that's contributing towards them actually making looking tired. And through that discussion, it's about the practitioner helping to facilitate the patient to understand the process of aging and what's actually changing and what can be restored. In at number 2, dermal fillers are too expensive.
Well, to be honest, you're going to get what you pay for. In the UK, you can purchase fillers on the black market for as little as nothing, like £20 or something. And you go and get these treatments done for that much price, and undoubtedly you're going to end up with a botched job, because the quality of the product really, really matters. Like we said before, there's over how many? Like there's 200 different brands of filler.
More than that, yeah.
Yeah, there's over 200 different brands of filler, and we only like maybe 5 out of those, and in clinic we only use 2, and that's after lots and lots and lots of research into them and using them and seeing what they like over years, because you don't want to just see what it's like immediately after. You need to see what it's like over the years. You know, that certain products migrate, certain products can become lumpy, certain products can cause problems down the line in terms of nodules and things like that, which, you know, we want to stay well away from. So the quality of the product really matters, and that's what can make it expensive, number one. Number two, it's your practitioner and their experience. You don't want to just go to any Tom, Dick or Harry to get these treatments done. This is your face. Don't cheap out on your face. It will not be worth it.
Yeah, just going back to what you were saying about quality of product, I mean, when it comes to dermal fillers within the UK, there are the medical grade of dermal fillers which come from a medical pharmacy, which can or sometimes are prescription based, sometimes they're not prescription based, and these are ones that are highly regulated, a huge evidence base, a lot of research has gone into them. And then you've got these other types of dermal fillers which exist with no evidence base behind them. So I actually feel sorry for patients, because when they're looking at something and they see the word dermal filler doesn't really mean anything, because there's such a huge difference in quality out there. To give you an example, our preferred brand for most treatments will be something like Teoxane. Now, Teoxane is a brand that specialises in two things in particular. One is going to be natural look aesthetics when it comes to dynamic movement. So, like Zoya mentioned, it's not just about how the treatment looks straight afterwards, but how does the filler respond to different shear forces or pushing and pulling forces that are actually happening to the filler within your face. When you smile, does the filler smile with you, or does it start to distort and move around and start to break up and migrate? All of these things are indicated by quality of product. The second thing is going to be longevity. It's not just about you getting a treatment today with a good before and after today, but how does it look in 6 months' time, 12 months' time, 18 months' time? There are some lip filler products out there which last about 3 months. Likewise, you're going to have some that can last 12 months or even longer. So really, with quality of product, like she said at the start, you really do get what you pay for.
And also, like Sanjay said, where is your product coming from? Like, why is it cheap and why is it expensive? Isn't just down to the quality of the product, but also where it comes from. So, for example, if your product, and most of these products are manufactured abroad, how are they quality controlled in terms of like the temperature management all the way? When you're getting it from a pharmacy, which we do, all of that is regulated. Whereas when you're getting these super cheap products, they've just been on a plane, sitting at the back of a truck somewhere for God knows how long, and then they're going into your face. Like, I'm not trying to scaremonger, but that is literally what is happening. So you've got to be really careful with what goes into your face. So in at number one, this is the most commonly asked question about dermal fillers in clinic, and that is, will my dermal filler treatment go wrong?
So generally, when we talk about fillers going wrong, it's going to be down to one of a few different things. 1, quality of product. 2, the technique that's been used. 3, the actual consultation with regards to the patient understanding what the treatment is and the practitioner understanding what the patient wants, because that's going to help determine the right quantity for what it is you're trying to treat.
So with all medical treatments, there is always going to be an element of risk. With dermal filler treatment specifically, in the right hands, that risk is very low. But saying that, even though the risk is low, you want to go somewhere that is able to manage all of those potential complications. You don't want to go somewhere that's going to leave you stranded. I mean, we see so many people that come from other clinics where, you know, they're having some sort of problem like an infection or something, and they've just been left stranded, no antibiotics, no aftercare, no anything. Whereas you've got to go somewhere that is going to really look after you.
I guess it's about the clinic taking ownership of the patient and looking after the patient through the entire journey, even extending it to beyond the procedure, not just in the weeks after, but the months after. In terms of the risks of the procedure, I guess you've got different levels of risk. So you've got the common ones, which are always going to be things like potentially a bit of bruising or a little bit of swelling, always possible with an injection. But then for more of the scarier risks, like an infection or like a vascular event, these are not common events if things are done safely. But if something were to go wrong, is the filler that's been used completely reversible? Because that's very important. Is it something that's going to respond to antibiotics if you were to get an infection? Again, that's very important. And when it comes to complications management, myself and Dr. Zoya actually published globally in the guideline for how to treat certain complications.
So there you have it. Those were our top 5 reasons why people avoid having dermal filler treatments.
If I could give one take-home message, it would be that the patient always has to feel completely comfortable. And I think that starts with patient education, because the more the patient knows, the happier they're always going to be.